everyone, this is Dr. Meghan Karol, a pelvic health specialist, physical therapy. And today what we're going to be talking about is normal ranges for urination and defecation, not your typical morning conversation. So a lot of times for our bathroom habits, I feel like we don't really know what's normal or not normal because all we have to compare is ourselves unless you're out there talking about it. And then someone looks at you and you're like, what? That's what you do? That's not what I do. That's not normal. Or is that normal? Am I not normal? So here are those norms. So for going to the bathroom for a urination, for peeing, it should be every 2 to 4 hours. Now, the first comment that most people will say is, oh, well, I drink a ton of water. I'm like, okay, maybe. But you also want to kind of look at your output too. So if you sit down and you start peeing and you do a 1 Mississippi, 2 Mississippi, 3 Mississippi, and actually sort of count the seconds of your urine stream, it should be about an 8 to 10 second stream. So if you're going really frequently, if you're going every hour, but you're only kind of putting out about 6 seconds worth of stream, there might be a mismatch there. We might want to stretch that out a little bit more to have better control. You are in charge of your bladder, not the opposite way around. Now, as for your defecation, norms are actually every day to every 3 days. Now, you'll hear some talk that maybe that every 3 days shouldn't quite be considered normal, that with a healthy diet, lots of fiber, hydration, movement, and activity, more healthy is every day to every other day. But I will say that the norms are considered every day to every 3 days. Now, the biggest thing I like to really push forward is constipation is more so looked at for the consistency of your stool, not as much on the frequency. So if you look down at your bowel movements, and you should be checking in on them, they tell a lot about your health. But it's a terrible analogy, forgive me for this, but they should be coming out like soft serve ice cream, formed but soft. Maybe a little bit lumpy depending on your flavor of ice cream, but it should be soft and formed. If it is very loose and sort of ragged and mushy or even liquidy, that's erring towards the diarrhea side. If it's really, really stiff, hard to pass, maybe almost coming out like rabbit pellets, that's pushing towards the constipation side. So ideal is soft serve ice cream. Now, some people will have days of diarrhea and then a constipation, days of diarrhea and then a constipation. And essentially, if you have a really, really firm bowel movement trying to make its way through your intestines, the only thing that can get around it is liquidy stool. So if that's also what you're experiencing, then I would kind of think and treat more so on that constipation side to get that into more of that normal range. So I hope that's helpful for you in terms of, assessing to see if you fall within those sort of normal guidelines. And then we'll be talking about tips to sort of help you get in there.